Access Healthcare welcome you to Bladder Cancer Treatment Guide. This module is part 1 of a 7-part series on bladder cancer. Bladder cancer is one of the most common cancers, affecting approximately 68,000 adults in the United States each year. Bladder cancer occurs in men more frequently than it does in women, and usually affects older adults, though it can happen at any age. Although it's most common in the bladder, this same type of cancer can occur in other parts of the urinary tract drainage system. About 7 out of every 10 bladder cancers diagnosed start out at an early stage when bladder cancer is highly treatable. However, even early-stage bladder cancer may recur in the bladder. For this reason, people with bladder cancer typically need follow-up tests for years after treatment to look for bladder cancer that recurs or advances to a higher stage. In this course, the objective is to help you know the basic information about bladder cancer. Your bladder is a hollow, balloon-shaped organ in your lower pelvis. Urine enters your bladder from your kidneys through small tubes called ureters and stays there until you urinate. When you urinate, your bladder walls contract and force the urine out through a tube called the urethra. Your bladder wall has 4 main layers. The innermost layer is called urothelium, or transitional epithelium. Almost all bladder cancer starts here. After the urothelium is a thin layer of tissue, blood vessels, and nerves. Behind this is a thick layer of muscle. The outer layer is made up of fatty tissue. Normally, new cells grow and divide as your body needs them, then die when they are old and damaged. But if you have cancer, new cells form when your body does not need them, or damaged cells do not die when they should. The extra cells build up and form a mass of tissue called a growth or tumor. The types of bladder cancer you have depend on which bladder cells become cancerous. The most common type is urothelial carcinoma. It is also called transitional cell carcinoma, or TCC. It begins in the cells that line the inside of your bladder. This is the part that stretches and shrinks when your bladder is empty or full. Since urothelial cells are also found in your urethra, ureters, and the lining of your kidneys, your entire urinary tract will need to be checked for tumors. Uncommon types of bladder cancer include squamous cell carcinoma, adenocarcinoma, and small cell carcinoma. Squamous cells are flat and thin and may appear after a long period of infection or irritation. Adenocarcinoma starts in the cells of mucus-creating glands that line your bladder. Small cell cancer starts in the nerve-like cells called neuroendocrine cells. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of this 7-part series on bladder cancer, and come back for part 2.